Hi, my name is James Clem. Welcome to this tutorial. I want to connect with you on several things that I find really important in my clinical restorative theater. I think this will parallel with you because as dentists, we want to do good work. You know, OCD margins, we want the color to be right, we want the occlusion on. Those things are really important to us. One thing that I want to convey, particularly about this webcast series or all the videos that we have on cadstar.tv, and that is simplify to maximize our outcome. Now, I've been known for my aesthetic work. Little do people realize how simple I am. Now, it's true, I break things into simple little steps. For me, that way I'm proficient and efficient in my clinical theater. It's really important to simplify. Due diligence, that's why you're part of this website membership, and that is we convey and provide a lot of education for you. We continually update our series and add new information. It's really important that we stay current so that way we can optimize our clinical theater. A friend of mine, Dr. Paul Homley, came up with this phrase, it's what we leave behind. There's a lot of applications to what we leave behind in the relationships we have in life with our patients, our team members, our clinical dentistry, something that we're really proud of and we have personal fulfillment. That's one reason why I'm a CEREC user. I can obtain the clinical dentistry that I feel is optimal for my patient because I have that control. So let's talk about simplifying to maximize our outcome. These are the 5 important things for me, and I think will resonate with them. Ideal interproximal contacts, that's so important. I remember when I did a mini residency at UOP in Perio, one thing we looked at was particularly in the aging population. I'm part of that now. I was in the 30s at the time, now I'm in my 50s. Our soft tissues recede somewhat, may not necessarily be periodontal disease, but we can pick up buccal, lingual, cervical food impaction zones. So it's really important that we are able to close those areas. In this video series, I'll talk about an important aspect of how we close buccal, lingual, cervical embrasures, particularly in how we prepare so the CEREC can do its job and we don't have to be specialist at design because the CEREC is so intuitive. Number 2 is closed margins. OCD margins. I work on a lot of dentists. Interesting. I have an OCD patient for margins in the chair and I'm OCD. Well, with CEREC, we can definitely nail those margins. In my hands, my CEREC milled margins are definitely the standard for me, as good as anything I've ever seen in a laboratory. Now, there is a learning curve to that, which burrs you use to prepare your teeth with, how you finish the margins, how you capture the margins, your parameters. How about the burrs we use to mill our crowns based on the margin style? Sometimes I'll do a feather based on certain circumstances. I'll do a light chamfer, I'll do a moderate chamfer, I'll do a shoulder. I use them all based on materials and the demands of the case, particularly when it's aesthetic. So those things are really important to me. I've got to close margins. Yes, I love the CEREC for Occlusion Mastery, particularly when we think of where we want to place our occlusal profile contacts. It is accurate, particularly with the buccal scan, and now we have articulation for more comprehensive cases, and we have virtual grinding features where we can virtually adjust our occlusion before we ever mill. Will it be accurate? Well, it is accurate if we take our optical impressions properly and understand the parameters. It's really, really accurate for me. I expect, get this, shim stock quality. 8 microns is where I want that final restoration to be, so I'm not adjusting occlusion and I don't have lateral interferences. How about biomechanical compatibility and also biocompatibility? We have a lot of patients, particularly with the internet, that are more concerned about the materials going into their mouth, and they'll have a lot of information coming in. I get a lot of patients that are very concerned about biocompatibility. So it's really important to know your materials. Fortunately, the materials we have available for us with CEREC are very biocompatible. And last and not least is longevity. Now, having practiced just about 30 years, I tell you, it's humbling. The mouth is a hurricane environment. We don't want to lack a longevity because maybe we weren't operating at the highest level. That's really important for us ethically, isn't it? I always use gold as my standard, even though I don't place a lot of gold restorations anymore. It's always been the standard. Now we have what we call, you got it, it's called EMAX. EMAX at 10 years out is showing statistically the same longevity, benefits and assets as we see in gold, and maybe a little better, particularly if we're bonding to enamel and providing more conservative restoration prep styles. I still do a lot of onlays. I don't always drop a margin subgingivally if the cervical enamel is healthy. Therefore, I have better longevity because I can finish my margins and bond that to enamel, which we know is a very good long-term bond with the literature today. 5 things that are important to me. I think those 5 elements are important to you as well, and that is doing good fundamental restorative dentistry. That's important to me with CEREC. CEREC is not my command theater. I command the CEREC, so the CEREC doesn't command me. It's how I prepare the clinical theater and manage the restorative demands and important applications that, particularly of the material, and when I apply that to CEREC, it works really smooth for me. That's what this online training is all about, yet it's important to kind of get back to the basics, kind of like training camp. Even professionals go to training camp, and that's what this online CADStar TV is all about. It's training camp and also a reference, and the information here will continue to evolve as materials and the software and hardware evolve. We want to make sure you're having joy in your life, because that's important. And the greatest joy we have is when we learn from our hiccups. It's been said that when you have a manure experience, it's nothing but fertilizer. There's 2 things you can do with the fertilizer. You can either grow a garden or you can let it fester and ferment, which isn't too cool. So this site is about fertilizer, and that's growing a garden of success. Thanks for tuning in.